let's dive a little deeper into acne. You mentioned benzoyl peroxide earlier, chemical exfoliations, but where do we sort of begin with the evidence looking at acne and skincare? What do we understand about active ingredients? Or if someone's listening now and they're struggling with acne, what kind of direction would you give them that would lead them to perhaps finding the most effective products that are going to help them the best with acne?
I think with acne, there are a lot of over-the-counter options. The ones that are recommended in Australia and are actually approved in Australia, benzoyl peroxide is probably the main one. Benzoyl peroxide comes in lots of different forms. The main ones are like leave-on creams as well as cleansers. So I would probably start with the cleanser just because it's a bit more practical. So it doesn't fade pillowcases and towels as much. There's also salicylic acid, which is not technically a drug in Australia, I believe. Yeah, it's not a drug, but it is in the US for acne and in a lot of other places too. So I would probably also look for a leave-on salicylic acid product, probably at about 2% concentration. So that's a good chemical exfoliant that helps those skin cells shed and keeps the pores clear. So the things that contribute to acne, there's 4 main factors. One of them is basically pore clogging. Then there's also the acne bacteria. There's also there's hyperkeratinization, which is too much skin cells, like clogging. Actually, no, I think those two are the same. There's oil production and there's also inflammation. So things that target these will reduce acne. And so, the salicylic acid will tackle the skin cells, too many skin cells clogging up pores. And the benzoyl peroxide targets that as well as kills the acne bacteria. Salicylic acid is also anti-inflammatory. And so, you can sort of see the things that tend to be first options for acne. That tends to be things that target multiple pathways in acne formation. So those will be the first 2. There is also vitamin A derivatives. Like I said, there are vitamin A derivatives that can reduce acne. The ones that are for acne tend to be prescription only in Australia. So you might want to go see a dermatologist or even a GP. GPs can prescribe these. I think if your skin is, if your acne is really bad, like if it's leaving a lot of scarring, if it's causing you a lot of psychological distress, and you've tried a few of the options on the market and none of it's really helping, then I would highly recommend going to see a doctor or a dermatologist, and they can give you one of these stronger options that will hopefully, help you tackle your acne and maybe also identify if there's like some other contributor like PCOS.
Is the risk with some of these products that it could lead to sort of drying and flaking of the skin? Is that a concern at all with using benzoyl peroxide, for example, and some of those other acids? And is there a way to kind of prevent that, or is that something that in this instance you're not really worried about?
Yeah, so if your skin is really dry and flaking, that can actually increase inflammation, which can make your acne worse. So it's a good idea to have like a moisturizer as well, some sort of light moisturizer, like from CeraVe, Cetaphil, QV. Those have really nice light bland moisturizers you can use. But in terms of whether or not these active ingredients will cause that, with cleansers, it tends to be a lot more rare than with the leave-on benzoyl peroxide products. And a lot of salicylic acid products on the market now are formulated to be a lot more hydrating. And so the risk is a bit lower. But if you are experiencing tight skin, then go for a moisturizer too.